So I got Adam here with me today. One of the first cases that we managed together was a tough to treat lateral hip pain case. Adam, what was interesting about this case?
Yeah, so this patient had been through several months of physical therapy, had multiple lateral hip injections, wasn't seeing much good relief from it, and probably within 4 to 6 weeks of working with Alex here, she was in and out and left with virtually no pain and was able to get back to her life.
So one of the things that we do different here for lateral hip pain, we try to be very specific with the diagnosis. Lie on your side there, Adam. So lateral hip pain here, over the years the diagnosis has changed a little bit. There's usually some pain with sometimes climbing stairs, but from an examination standpoint, holding the leg up like this and testing that muscle, that's usually painful. Also, just palpating around that bony bump around the outside of the hip, that's painful. So we used to call this hip bursitis. Then over the years, the landscape kind of changed and we started calling it greater trochanteric pain syndrome, which is a broader diagnosis. But we know now that we can get more specific with that. In this particular case, she had gluteal tendinopathy. So the actual tendons were involved in this case. We did a diagnostic ultrasound scan on that to confirm that. And so we needed to change the rehab to really tendon-specific rehab, just like all of our other tendon protocols that we use. We do a lot of long isometric loading, so a lot of strengthening without a lot of movement. And then some of the other modalities, laser, active release technique to the soft tissues. One thing that a lot of people do wrong is they're stretching inappropriately. So we really want to avoid compressing the tendons at the attachment. So lie on your back and I'll show that stretch. This is the big stretch that a lot of people with this do. And if you have lateral hip pain and you're doing this stretch, just stop with this stretch. Focus on strengthening instead. And it's this simple knee to opposite chest stretch where you're stretching the glute. And what you're doing here is essentially compressing the irritated tendons against the bone and potentially irritating the bursa in that area as well. That's all we really did to help this person get back on track, and she was discharged, nearly 100% recovery, and we haven't seen her since, assuming she's still doing great.